In this podcast episode, Dr. Vonda Wright, a double board certified orthopedic surgeon and recognized expert on performance and longevity, joins Dr. Hyman to discuss the unique ways women age, particularly focusing on the critical decade between 35 and 45. The conversation delves deep into why women, despite leading the longevity race by living on average 4, 5 to 6 years longer than men, often experience more profound declines in health, muscle, and bone quality as they age. Dr. Wright's passionate advocacy for evidence-based approaches to beating pain, frailty, and fat gain after 40 emphasizes strength training, hormone management, nutrition, and the urgent need for more research focused on women's health. Dr. Wright opens by highlighting the underappreciated fact that women do not age like men. While women live longer, the period from their mid-30s to mid-40s marks a steep transition caused primarily by a sharp decline in estrogen production as ovarian reserves run low. This hormonal shift accelerates aging in nearly every tissue, bone, muscle, brain, and heart, due to the absence of estrogen signaling pathways that regulate vital protein transcription and tissue maintenance. Despite the significance of this transition, women over 40 have historically received only about 1 to 2% of research funding targeted at their specific health needs, leading to gaps in understanding and medical care. Dr. Wright notes this neglect amid a landscape where women over 40 make up to 25% of the population, emphasizing the urgent need for dedicated research on this demographic's unique aging process. The podcast touches on the pivotal role of hormone replacement therapy, HRT, particularly estrogen, in easing menopausal symptoms and preventing long-term frailty. Dr. Wright reviews how the 2002 Women's Health Initiative, WHI, study dramatically altered the perception and prescription practices of HRT by broadly vilifying it based largely on data from older women, ages 60 plus, not those in early menopause. The study's premature termination and press release suggested a strong link between estrogen and breast cancer, although the absolute risk increment was less than one additional case per 1,000 women and did not affect mortality. More importantly, the synthetic hormones used, such as conjugated equine estrogens and progestins, differed significantly from bioidentical hormones produced by the human body, leading to adverse effects that were generalized to all forms of hormone therapy. Dr. Wright stresses the need for nuanced conversations and informed choices, urging women not to avoid hormone therapy out of fear, but to consider it proactively, based on facts tailored to their individual health profiles. Vaginal estrogen, for example, is highlighted as a low-dose, locally absorbed therapy that reduces urinary tract infections and improves sexual health without significant systemic absorption, an option that many women are unaware of but should consider for overall well-being. One of the most critical health challenges for aging women is sarcopenia, the gradual loss of muscle mass, strength, and function. Rather than being a mere cosmetic or mobility issue, muscle is a powerhouse metabolic organ that secretes proteins influencing bone density, fat metabolism, immune function, and even brain resilience. Dr. Wright explains how muscle loss correlates directly with frailty, increased fall risk, dependency, and entry into nursing homes, the majority of whose residents are women. Declining muscle also accelerates fat gain and metabolic dysfunction, further compromising health. Muscle decline begins as early as age 30, with losses of 3 to 8% per decade if not actively countered. This muscle wasting often goes unrecognized by doctors, who rarely screen for it or provide evidence-based interventions. Dr. Wright passionately underscores strength training as a cornerstone intervention to combat sarcopenia, frailty, and fat gain, especially for women over 40. She differentiates between types of lifting: endurance, high reps with light weights; hypertrophy, moderate reps with moderate weights; and strength power training, low reps with heavy weights. For aging women, building neuromuscular coordination and power is essential to prevent falls and maintain independence, which means lifting heavier weights for fewer repetitions, 3 to 6 reps per set taken to failure, combined with proper technique and gradual progression. Notably, even women with osteoporosis can safely engage in supervised heavy lifting programs after gradual conditioning, which challenges common misconceptions that lifting is dangerous for frail bones. Dr. Wright shares success stories, including women who transformed their capacity, body composition, and outlook on life through persistent strength training, proving it's never too late to reverse muscle loss and reclaim vitality. Recognizing that strength alone is not enough, Dr. Wright highlights a multi-dimensional fitness approach encapsulated in her acronym FACE, flexibility to maintain joint and tendon health. Aerobic fitness for cardiovascular resilience, carrying load to build functional strength, and equilibrium balance training to prevent falls. Incorporating practices such as Pilates and yoga enhances flexibility, while interval and base training improve metabolic health. Foot speed and balance are often overlooked, but pivotal factors, especially since slower reflexes and diminished coordination contribute significantly to fatal falls in older adults. These nuanced elements complete the fitness picture for women seeking to remain unbreakable beyond 40. Dr. Wright calls out the cultural conditioning many women face about calorie restriction and weight fear, which often leads to chronic undereating, protein deficiency, and inadequate muscle maintenance. She emphasizes the importance of consuming sufficient protein, recommended around 130 grams per day for active women, distributed throughout the day, along with a diet rich in high-fiber carbohydrates and healthy fats like avocados. Rather than relying heavily on calcium supplementation, Dr. Wright advocates getting calcium from whole foods like dairy, sardines, and leafy vegetables, noting that bone quality and strength are influenced more by collagen integrity and bone microarchitecture than just mineral density alone. Vitamin D supplementation remains important, but primarily for its role beyond bone, such as immune support and reducing aches and pains related to osteomalacia. To truly beat frailty and fat gain, Dr. Wright insists on early and routine diagnostics starting by age 40. Bone density assessments should be standard, ideally augmented with technologies like ultrasound-based bone quality scans to detect vulnerabilities before fractures occur. Body composition testing is critical to differentiate muscle from fat and to identify sarcopenia early. Labs should monitor metabolic health markers, glucose, insulin resistance, advanced lipid profiles, organ function, and inflammation. Hormonal assays are key, especially for testosterone and estrogen levels, as preemptive hormonal optimization can drastically alter aging trajectories. Cardiovascular risk assessments, including coronary calcium scoring when indicated, complete the picture for a personalized longevity blueprint. Dr. Wright stresses that aging poorly is not inevitable. It is often a product of societal neglect, lack of education, and gender bias in research funding. She calls for philanthropic engagement to fund women's health research beyond the paltry percentage it currently receives. Women's health encompasses complex areas such as microvascular cardiovascular disease and autoimmune disorders that differ vastly from men's. On the clinical front, combining foundational lifestyle medicine, exercise, nutrition, sleep, stress management, with cutting-edge regenerative technologies such as platelet-rich plasma and stem cell therapies holds promise, especially as minimally invasive procedures reduce recovery time and improve outcomes. The episode concludes on a hopeful note with powerful anecdotes illustrating that no matter a woman's age, or even after setbacks like surgery or chronic illness, she can rebuild strength, reverse frailty, and reclaim her vitality. Success depends on consistent effort, proper knowledge, and targeted action. Dr. Wright's new book, Unbreakable, A Woman's Guide to Aging with Power, encapsulates these messages, empowering women to view aging not as an inevitable decline, but as an opportunity for strength, resilience, and renewed life.